Hi, Dr. Pelto here. Stem cell therapy can be an important option for certain patients with Achilles tendonitis. I recently treated a 60-year-old female woman. She was an avid runner, and she developed bulbous changes to her Achilles tendon. The word bulbous means thickened due to injury with many little micro tears. This makes the tendon scarred and thickened and painful. And she had seen multiple doctors for evaluation and had a course of physical therapy without success. Also, she had tried ice, NSAIDs without success, and the patient had really given up until she came into our office. When I see a patient for a second opinion for chronic Achilles tendonitis in the office, the first exam I perform is an ultrasound. This allows me to see the thickness of the Achilles tendon and compare it to the non-painful side. Her ultrasound was similar to the image. You can see the dark color inside the tendon, and that darkness represents water or inflammation. There are little micro tears in the tendon that were not able to heal on their own. This constant re-injury is because we are always using our Achilles tendon when we walk. How did I treat the patient? A portion of the treatment was stem cell therapy. The first part was recruiting her own stem cells with a treatment called shockwave therapy. This treatment involves 3 to 6 sessions of shockwave therapy a week apart to recruit her own stem cells by giving a dosed amount of shockwaves into the injured tissue. Basically, it wakes up the body to recognize there is an injury and tells the body to send good healing cells into that area. The second recommendation was an amnio injection. This is taking cells from an area of the placenta that are very potent at reducing inflammation. These cells are injected under ultrasound guidance, and they are placed in the area of tearing or injury. I usually do this after the second shockwave treatment. This combination of stem cell treatment and shockwave therapy is important so that those with chronic Achilles tendon pain can get better. Only those that suffer from Achilles tendonitis know what I'm talking about. They tend to have difficulty going downstairs, walking up hills, and even walking when they get out of bed or up from their car. Many patients have been told by their doctors or podiatrists that nothing else can be done for their Achilles tendonitis. These same patients have many times tried shoe changes, orthotics, icing, anti-inflammatories, and physical therapy without success. They suffer and think that they have to live with the pain because they have given up on getting better. There is help, and you don't have to keep living in pain. Stem cell therapy could be the answer you need. I will put a link here for you to get the same resources I give my patients about this condition, and it will give you an option to make an appointment if you live in Massachusetts.